Hello everyone, Namaste. I am Dr. Kiranmay Gotapu, consultant obstetrician and gynecologist at Apollo Hospitals, Health City, Visakhapatnam. I am a minimal access surgeon. The field of minimal invasive surgery in gynecology has grown exponentially in the last few decades, and its advantage in benign gynecology has been widely utilized, keeping the requirement for the conventional laparotomy, that is the open surgery, very low. Actually, it is the quest for the improved patient outcome or the improved patient safety which is the actual driving force that makes us to adopt these novel and better surgical techniques. The minimal invasive surgery in gynecology can be through a hysteroscopy or a conventional laparoscopy or a robotic assisted laparoscopy. So let us see what is hysteroscopy. So hysteroscopy is a procedure wherein we keep a telescope attached to a camera into the uterus and we look into the uterine cavity and we visualize the uterine cavity clearly to diagnose some conditions such as endometrial polyps or a submucosal fibroid, that is the fibroid inside the uterine cavity, or an intrauterine septum, or any abnormal endometrial growth that can be diagnosed and at the same time operated also through hysteroscopy. And as you all know, laparoscopy is performed through multiple keyhole incisions in the abdomen, wherein we keep the telescope and the specially designed instruments into the cavity through those keyholes, and we look into the abdominal cavity with magnification and perform the surgeries with a better precision. So let us see what is the scope of this endoscopy in gynecology. So in gynecology, we look for this minimal invasive route approach for both diagnostic purposes as well as therapeutic purposes. So diagnostic purpose, diagnostic laparoscopy we recommend for wherein we couldn't arrive at a diagnosis or that is the cause of the disease through clinical examination or imaging like ultrasound or CT or MRI or whatever. Or sometimes even to confirm the ultrasound findings also we do a diagnostic laparoscopy. So a diagnostic hysterolaparoscopy has got a huge scope in infertility, especially to diagnose the tubal blocks or for some conditions such as when we suspect an ectopic pregnancy or an endometriosis or unexplained abnormal uterine bleeding and many more. So coming to the therapeutic indications, most of the gynecological procedures can be performed through minimal invasive route, that is either laparoscopy or robotic assisted surgeries. So let us see for example the conditions on the fallopian tube like tubal ligation or a tubal recanalization, that is rejoining of the tubes after ligation, or a tubal ectopic pregnancy as we have already discussed. Say for the conditions of ovary, if the woman requires a removal of the ovary, that is oophorectomy, or just removal of the cyst from the ovary, we remove the cyst, retaining the normal ovarian tissue, and we can easily reconstruct or reshape the ovary back to near normal through this minimal invasive route. And say for the conditions of uterus, like a resection of an adenomyoma or removal of the fibroid, that is myomectomy, or removal of uterus, we say hysterectomy, can also be done through this minimal invasive route. And also for some conditions of pelvis like adhesiolysis, that is release of adhesions may be formed due to previous multiple surgeries or pelvic inflammatory disease, or it can be formed by endometriosis. And for sacrocolpopexy, that is done for wall prolapse. Wall prolapse is the descent of the vagina or wall after removal of the uterus. So we secure this wall to a bony prominence through a mesh, and this surgery requires a very precision, so that can be completely achieved by the laparoscopy, or even better precision we can acquire by robotic procedures. And also the minimal invasive surgery has got a huge scope in gynec oncology, that is for procedures of uterine cancer and cervical cancer, including the pelvic lymph node dissection, can be done with better precision compared to open surgeries. So let us see what are the advantages of this laparoscopy over conventional laparotomy. So in conventional laparotomy, we give 10 to 13 centimeters incision, whereas in laparoscopy, we perform through small 0.5 to 1 centimeter incisions. So laparoscopy offers us, the first thing is the magnified view and smaller incisions. So because of this magnified view, we have better precision in surgery with less blood loss, so the patient will have better outcome. Second is the miniature incisions. Because of these small incisions, it will be more cosmetic with less chances of infection, less chances of hernia, less chances of postoperative adhesions with minimal perioperative or postoperative pain and shorter hospital stay. And the women can return to their normal daily activities very early, and it will be a faster recovery for them. So coming to robotics in gynecology, robotic surgery is the most advanced platform in minimal invasive surgery available today. So the robotic surgery is also performed through the same similar miniature incisions as we do in laparoscopy. But the integration of this three-dimensional, high-definition, stereoscopic, binocular vision associated with the specially designed instruments, that is EndoWrist instruments, which can replace the human hand. Because of these high features, the robotic surgery can overcome the limitations of the conventional laparoscopic techniques even, thus offering us the better precision and better microsurgical details, thus resulting in improved, better patient outcome and the surgical outcomes. So, I strongly believe in this minimal invasive route, and I recommend and I request every woman to please consider for this minimal invasive route before going for any gynecological procedures. You talk to your doctor, discuss about the opportunity of the minimal invasive route rather than opting for the open surgeries with bigger cuts and higher morbidities. Thank you.